I am Kim Smith, founder and CEO of Health Evolve Technologies. We are a digital health innovation company closing the gap on maternal health disparities. Well, I have been in the healthcare space for some time. I'm a board certified healthcare executive, 18 years of experience. And I got excited about maternal health because of an unfortunate loss of our daughter, Lauren Kelly, 13 years ago. But I was excited about the possibility of change. And after over a decade of that advocacy, and being really good at growing the corporate machine of medicine, I decided to leave and launch Health Evolve, to really utilize innovation to address an important problem that impacts really all of us, maternal health. There are millions of women entering pregnancy with risk factors around high blood pressure, diabetes, and of course, chronic stress plays a role. Our mortality rates in the US are extremely high compared to other developed countries. And unfortunately, there are millions of women with the signs of maternal morbidity. So that's the cardiometabolic disease because of things that happened and were revealed during pregnancy. So my goal is to equip women with the tools they need during their pregnancy period across those 100 weeks of care to thrive, to be healthy, to get their blood pressure, their diabetes under control, to be educated on how to improve their health, and also to connect with their care team through this health at home model of the Lauren platform. The technology itself includes two pieces. There's a user application that can be downloaded from the App Store or Google Play Store. It has API connections to a self monitoring device, and the data is shared in real time with their existing care team on a HIPAA compliant clinical portal. So it has those two pieces, the app and then, of course, the portal. We're able to, of course, within the app, we baked in an incredible chronic care management curriculum specifically designed for birthing women. And are also able to see their numbers, manage their care, and be equipped with also how to prepare going into their doctor's offices up through 6 weeks postpartum. And then we help them transition back to work. So I launched the company January of 2023, really to start building. And I first reached out to about 9 individuals that I knew were a lot more well versed than me in this space. And they all said yes to being a board advisor. And we started our journey of building and putting myself in the hot seat on purpose every month to have that accountability and to help and to have that help. So we've been able to go from that blank sheet of paper to a prototype to piloting in 5 rural counties in South Carolina within 18 months. We've received funding from the South Carolina Research Authority, 2 specific grants. There's 2 signature grants. We've received both of those as a member company. We received funding from the NSF with this National I-Courts program that we're now a part of, as well as other accelerator programs, all non-dilutive funding. So technically, I still own 100% of the company, but we're looking to give away some of that now with our initial raise. We have actually 3 priorities. We just talked about this in our board meeting last week. One definitely is to launch version 2 of Lauren. We've learned a lot from our pilot in rural South Carolina, and excited about what we're literally incorporating now as the hood is up in the build. The second is investment. So we're having some exciting conversations with pre-seed, seed investors that are very interested in maternal health specifically. So we're excited about raising capital as we're preparing for the yeses. And I would say the third thing is to prepare for our regulatory path, and that's baked in research. So I mentioned the NSF grant before. We're exploring some exciting things around what can we learn about stress with birthing women, and how can we even potentially either create our own device in the future, or incorporate some clinical algorithms so that we can transition Lauren to being a SAMD. That takes some time, so we're able to follow those paths parallel because of the research partnerships we have with Prisma Health, with the University of South Carolina, and the College of Charleston. So those are the 3 key things we're laser focused on this year.